So this question was about children with spina bifida living longer. Are more neurologists, neurosurgeons, and other doctors being trained and willing to care for children when they transition to adult care? Or are they considered too complicated? What are some of the roadblocks? So this is a great question, a very difficult one. I think it's complicated and it varies very much regionally. This is one that I don't have much information on directly, and I got this actually from Dr. Church, who's here in the audience, so she might be able to add more to this here. From our perspective here, we do try to transition them to adult neurosurgeons who have expressed enough interest and expertise in this area to be able to manage children who are now adults with these conditions. And as Dr. Church has told me, that there is, maybe I can just ask you to comment directly rather than me paraphrasing your words. Is that okay, Paige? You want to?
Yeah. So we were lucky. We have Bill Schatz here, our MP. Through the Toronto Central LHIN, we were asked to look at ways to make healthcare more efficient. And one of the major obstacles we have in pediatrics is moving children with any complex medical condition into adult medicine. We were then asked to pick a pilot population, and a little bit of the fox in the hen house. I automatically went for spina bifida. And so we created this transitional program where a nurse practitioner with a background in primary care meets our children and adolescents as they become adults and gets a relationship established with them, so that then as they approach 18, it isn't this crisis point of meeting a new healthcare provider for the first time. She's gotten to know them, she's gotten to know the ebbs and flows of their health, their baseline. And then as they approach 18 and they're no longer allowed to be in the pediatric world, and it's not necessarily in their best interest to, they transition over to the adult world with a bit of a navigator or a diplomat to help them succeed on the adult side. We're still in the process of working out our network for the subspecialties. We have interests sort of scattered around the hospitals, and sometimes that's not the best arrangement for people, so we're really trying to hone that down. But having that person that can be the sounding person for young adults as they go away, they may not see her that often, but if something comes up and they're not getting the answer they need, they can come back to her and say, does this make sense? That's huge. It's huge for young adults. So we're very excited. And Bill Schatz just joined us 2 weeks ago, 3 weeks ago. No, a month ago. Anyway, I was on vacation, so for me it was a long time. Anyway, we're very excited to have her, and she's already doing a great job stepping in.
Well, I applaud those efforts because it's greatly needed. I mean, this is a difficult scenario, and it's certainly very poorly done at all centres across Ontario, as far as I can see, and we're no different. Partly the framework of adult patient care is very different than the framework of pediatric patient care. Pediatric hospitals have traditionally worked as in terms of comprehensive clinics. You go to a spina bifida clinic and you've got a neurosurgeon, a neurologist, urologist, an orthopedist who deal with all these issues. And we don't have that traditional setup in adult hospitals. One can very well ask why, and I don't have a good answer. The other thing that pediatric hospitals do very well is they have the child life workers who are there to support the parents and the patient as they go through this process. And in reality, what happens is individuals reach 18 years old and that just simply stops. And now they're adults and they're kind of left to navigate through the adult system. So I think having the idea of a transitional navigator would be very, very good. The issues, these are complex patients, and there's no question the treatment issues are complex, and there's also no question that you'll find surgeons who are not particularly interested in taking on something of great complexity. But in every center there are individuals and surgeons who have the necessary expertise and the necessary interest as well. I think for people who are navigating their way through the system, it's very important to talk to your current neurologist or neurosurgeon, see if they can help in referring you to an adult who they know in another city who has the relevant expertise. I certainly get a number of handover, not just a letter saying, can you see this individual, but reams of notes and all the relevant background information on patients who are, in essence, graduated from a hospital for sick kids and who are resident in London, and we take over their care. But it is a process that is challenging, and I believe the ministry is starting to look at this a little more seriously and put some money into it.